Let's learn about the autonomic nervous system today. Autonomic nervous system deals with involuntary functions, which includes breathing, regulation of heart rate, blood pressure, digestion, production of urine, etc. When we are learning about the autonomic nervous system, it's important for us to see how it is different or similar to the somatic motor system, and also understand a little bit of anatomy that helps us understand the functions of the autonomic nervous system. So, we are familiar with the somatic motor system already. This is the lower motor neuron originating in the spinal cord and reaching a voluntary structure such as the skeletal muscle. So the main thing to observe here is the neuron that leaves the CNS ends directly on its supplier, the structure it regulates. Typically, it is a chemical synapse where a neurotransmitter is mainly acetylcholine. How is it different from the autonomic pathway? Well, the lower motor neuron that leaves the spinal cord, in this case it's spinal cord, but in some other cases it could be the brainstem area. Lower motor neuron that leaves the CNS doesn't end directly on the structure that it supplies, which we refer to as an effector. Instead, it ends in a ganglion. So this solid line is the first neuron that leaves the CNS, ends in the ganglion, synapses with a second neuron, the dotted line, which then terminates on an effector. Effector here is going to be an involuntary structure such as smooth muscle, glands, or adipose tissue. The synapse here is expanded. It looks different from the chemical synapse we saw with the skeletal muscle. Here you call this as a varicosity, that is, the axon has these bulges along its length and they could terminate on multiple sites at the effector. And the neurotransmitter could be acetylcholine or other neurotransmitters such as epinephrine or norepinephrine. So, in the autonomic nervous system, typically between the central nervous system and the effector, you have two neurons. The first one is called preganglionic neuron. That's because it's before the ganglion. The second one is called postganglionic neuron because it originates in the ganglion and leaves the ganglion to end at the effector. So preganglionic neuron, postganglionic neuron are classic in the autonomic nervous system. Well, the autonomic nervous system is in fact divided into two subdivisions, sympathetic and parasympathetic divisions. Sympathetic division is also called as thoracolumbar division. It's simply based on the origin of the preganglionic neuron. If you notice here, the preganglionic neurons originate from T1 all the way up to L2. So this is the portion of the spinal cord that gives rise to preganglionic neuron. That's the name. The reason why sympathetic division is also called as the thoracolumbar division. Based on its function, this division could be called as fight or flight system. Fight or flight is where there is excitation in the body, and many systems are activated, which we will talk about soon. Well, let's see what happens to the preganglionic neurons. Majority of these neurons are short. They terminate within a short distance at a ganglion. There are so many ganglia together that they are actually interconnected and form a chain of ganglia. So on either side of the spinal cord, you see a chain of ganglia that could be called as sympathetic chain ganglia. In here, the postganglionic neuron that originates will travel a good distance before reaching its effector. Postganglionic neuron in the sympathetic system is typically branched and supplies not just one organ but multiple organs. So effect of the sympathetic system is widespread. What are the structures that are supplied by the sympathetic division? Most of the visceral structures. You're looking at the reproductive system here, then the digestive system, urinary system. You're looking at the large intestine, small intestine, adrenal gland, pancreas, liver, blood vessels, stomach. These are all in the abdominopelvic cavity. Then you have the thoracic structures, the trachea, the lungs, the heart, and then the salivary glands, parotid gland, and sublingual gland, submaxillary gland, lacrimal gland, and the eyeball. So, and yet one more here, that is the skin, where you have the erector muscle. So a wide variety of structures receive sympathetic supply. Please note that these same structures, more or less the same structures, will also receive parasympathetic supply. So majority of these structures receive both sympathetic and parasympathetic supply. That's when you call it as dual innervation. All right, the preganglionic neurons are here. Postganglionic neurons typically travel a distance and reach their effectors. And there are some modifications to this. Some exceptions to this arrangement is that the preganglionic neuron may go through the chain of ganglia without synapsing and continue into the abdominal cavity, where they have their ganglia within the abdominal cavity. There are 3 such ganglia that you find in the abdominopelvic cavity: a celiac ganglion, superior mesenteric ganglion, inferior mesenteric ganglion. These are the 3 ganglia that you see outside of the sympathetic chain of ganglia. Yet another one that is of interest to us in the sympathetic division is the adrenal gland. Preganglionic neuron would reach the adrenal cortex, adrenal medulla, and supply the adrenal medulla. And some believe that adrenal medulla is part of the sympathetic division itself. Embryologically, that's true. Both the sympathetic division and the adrenal medulla originate from the same, the germ layer. All right. So that is just an overview of the details of the sympathetic supply. In here, the innervation is shown in a little bit more detail. You're looking at the preganglionic neuron. This is the sympathetic chain of ganglia, and the many different ways by which preganglionic neuron would synapse and then give rise to the postganglionic neuron. One in here, this is preganglionic neuron traveling as part of the spinal nerve. Yet another one in here, where you notice that it doesn't necessarily have to go through the same spinal nerve. It could travel within the chain of ganglia and then synapse with the postganglionic neuron and supply its effector. And here what you're looking at is the synapse is not in the sympathetic chain but elsewhere outside of the sympathetic chain.